So the answer is yes, this is really important to your job. Again, the amount of work that's expected of you, and now here's some additional workload. But we do know that by addressing substance use disorders, we are making our mental health work more effective.
And that's the important point. It's really not increasing your workload. If we treat these patients more effectively, it's decreasing your workload overall because your treatment is going to be more effective. So the interventions that you have to provide are going to be more powerful, they're going to be more effective, and therefore you're going to be a lot less frustrated and have a lot less of that countertransference stuff coming that happens.
Right, and one of our goals today is to hopefully develop some skills so that we aren't always stuck in the crisis-driven mode that a lot of co-occurring disorders patients bring to us. I'm actually going to show you a clip of Chris. Chris was someone who was treated in your system and successfully. He was someone with a co-occurring disorder, and it's just a brief snippet. John, were these films done, these were the ones from Rio Hondo, were they done like a couple of years ago? They took folks that were in their wellness center, and so this is Chris, and I think his story is a good one because I think it highlights people's experience very often in mental health symptoms.
Well, I knew something was wrong, but I didn't know what really. But then I look at my family past, and I'm like, oh, that's what it is. And bipolar. And they kept saying you have to quit drugs before we can help you. You know, and I couldn't do that. And I went into a rehab, and they said you have to quit drugs before you can come in. And I'm like, wait a minute, you know, if I could quit drugs, I wouldn't need a rehab. But I knew all along, ever since I was a kid, I had problems. I was not quite right. I was not quite the same as other people. And I think that's why I gravitated to drugs. One thing to fit in, and then it actually helped. You know, I wasn't quite as manic and stuff like that, so it actually helped, so, for a while.
There were several good interviews, but Chris is important, I think, in part because, one, I think he's a pretty good success story for your system. In a group where they were treating co-occurring disorders and they were very focused on the treatment of both simultaneously, they had a lot of good success stories, and he's an example. And then to complicate the picture even more, we're going to just briefly talk about trauma today and the layering of trauma that is added to this, because we know that mental health and trauma and substance use disorders really co-occur at really high numbers. The co-occurrence of PTSD and substance use among those in treatment is, you know, anywhere from 1 in 10 to 1 in 3, and for women it's closer to half. Up to 2/3 of men and women in substance abuse treatment report childhood abuse or neglect. And we see that people with PTSD and substance abuse are vulnerable to repeated traumas. So not only is sort of exposure to trauma a cause of substance use, in some ways it's also a consequence of substance use. So people who continue to use become more at risk for placing themselves into situations where they, again, are victims of trauma and victims of crime. And becoming abstinent from substance use does not necessarily resolve PTSD. Some symptoms may become worse with abstinence. When treating our patients who have trauma exposure, it adds an extra layer of difficulty because removing their sole coping mechanism, which has typically been drugs, can in some cases be more harmful to them. So there's a variety of trauma-informed treatments that are currently being dispensed, and people are training them around the community. But it's important to take into account the issue of trauma because many of your clients who have co-occurring mental health and substance use disorders also have trauma exposure. And again, treatment outcomes for those with PTSD abuse are worse than those for just substance use alone. And when we get to some of the stuff on screening and assessment, we're also going to look at some of bringing HIV into this as well as people who are at the forefront and people who are at the really in the front line. addressing issues of sexual risk and trauma that happen at increased rates with people with mental health and substance use disorders is important. Very often, you're the folks in the best position to identify and address issues of risk. And folks with severe mental illness are disproportionately affected by risk-taking. All right, so how do we treat co-occurring disorders? How many of you guys are familiar with the treatment improvement protocols? Any of you guys familiar with the tips? Okay. I think you guys have a tip in the front of your book. Is there a perfect? Thank you. There is a burned little CD. It is the Co-Occurring Disorders Treatment Improvement Protocol. The tips are SAMHSA-funded books or resources that address addiction in a variety of different populations. The tip that we burned for you, the one on co-occurring disorders, is about this thick, which is why we burned it for you and put it into a little disc. But what they do is they take sort of state-of-the-art, latest and greatest of evidence-based practices, and they compile them into a resource for clinicians. And they are, there's what, like 40 of them or something, or 50? 48 different tips. They're free to you. I think there's a resource on the table. You can go to samhsa.gov and you can order them. They'll come to your house. But they are really important tools in addressing substance use issues. And the tip gives us some sort of guiding principles, best case scenarios for how to treat co-occurring disorders. And the first we talk about is employing a recovery perspective. What does that mean, employing a recovery perspective? What does the word recovery mean? Yeah.
It means that you can recover from your state. The perspective is that recovery is possible from.
Good, that recovery is possible. Good, recovery is possible. When you think of the word recovery in the addiction side, what does recovery mean?
To recover from something you lost.
Okay.
This is where you talk.
This is where you talk. I heard clean and sober. The idea of recovery, from the addiction side, when someone is in recovery, what does it typically mean? Yeah.
Have a relief from symptoms of some sort, a relief from some distress.
Maybe some relief from symptoms. And the idea here, too, is you said getting clean and sober, or being clean and sober. Yeah.
The process of recovering?
It really is also a process. I think that's a key point, is that especially on the addiction side, if someone says, oh, I'm a recovered addict, you wonder if they're really done with it. You hear the word recovery, which implies it is always a process, and a process that requires some long-term addressing. It's a process that requires active work maybe for a really long time, if not indefinitely. And I think on the mental health side has the potential to sort of adopt that same idea, which is there might be a remittance of symptoms, but the potential for this to always need to be a process that one is addressing is important.